Good day everyone and welcome to my channel. So today we are going to talk about the hemorrhoids. What are the hemorrhoids, the causes, symptoms and how to treat them. Hemorrhoids are also known as piles, are swollen and inflamed veins in the rectum and anus that cause discomfort and bleeding. They can be either internal or external. So hemorrhoids are usually caused by straining during bowel movements, an overweight person, so-called obesity or obese, and when you are pregnant. So discomfort is a common symptom, especially during bowel movements or when sitting, and other symptoms may include itching and bleeding. Let's now talk about the two types of hemorrhoids because we do have the two types of hemorrhoids, which is external and internal. The internal hemorrhoids are painless and typically result from a constipated bowel movement, strained lifting, or even being pregnant. While external hemorrhoids occur when a blood clot develops around the rectum, causing painful lump and rectal bleeding. The signs and symptoms of hemorrhoids usually depend on the type of hemorrhoid. It could be external or internal, but let's talk about the two types of hemorrhoids. The external hemorrhoids, these are under the skin around the anus. The signs and symptoms might include itching or irritation in your anal region, pain or discomfort, swelling around the anus, and also bleeding. Internal hemorrhoids, they lie inside the rectum. You usually can't see or feel them, and they rarely cause discomfort, but straining or irritation when passing stool can cause painless bleeding during bowel movements. You might notice small amounts of bright red blood on your toilet tissue or in the toilet. So the causes of hemorrhoids: the veins around your anus tend to stretch under pressure and may bulge or swell. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for too long, having chronic diarrhea or constipation, being obese, being pregnant, having anal intercourse can cause that, eating a low fiber diet, irregular heavy lifting can cause hemorrhoids. So the treatment options for hemorrhoids include lifestyle changes. You must increase fiber intake. Fiber is a type of carbohydrate that cannot be digested by the human body. However, it plays an important role in maintaining a healthy digestive system, lowering cholesterol levels, and promoting feelings of fullness after eating. Fiber can be found in many plant-based foods, including fruits and vegetables, such as apples, berries, oranges, bananas, broccoli, potatoes, and etc. You must also drink a lot of water. You can also use over-the-counter creams or ointments such as hydrocortisone or witch hazel that can help reduce inflammation and itching. The barrier creams like zinc oxide can help protect the skin around the anus from further irritation. So also taking stool softeners like laxatives and also undergoing a medical procedure such as rubber band ligation or surgery can help reduce hemorrhoids. And lastly, there is the advice that I can give to you that if you have bleeding during bowel movements or you have hemorrhoids that don't improve after a week of home care, just talk to your doctor. Don't assume rectal bleeding is due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency, because rectal bleeding can occur with other diseases including colorectal cancer and anal cancer. So seek emergency care if you have large amounts of rectal bleeding, dizziness or faintness. As you age, your risk of hemorrhoids increases. That's because the tissues that support the veins in your rectum and anus can weaken and stretch. This can also happen when you are pregnant because the baby's weight puts pressure on the anal region. Thank you so much guys for watching my channel. Please subscribe, like and share. Thank you guys.